Hello friends, welcome back to my channel Medicine of 101. Today we will talk about from the aspect of pharmacology where we will talk about the drugs that is used in terms of the congestive heart failure. So our topic today the drugs that we use in terms of congestive heart failure. Okay. Now before starting the topic, let's talk about some few points regarding this topic. So see, whenever we are using the term congestive heart failure, that means what? The heart is not able to pump the blood. For example, if I just go over here, I'm considering this is the right heart over here. Okay. Just like this. Okay, now see, whenever the right heart is not able to pump the blood, as a result, whatever thing we'll see over here, see, if we see, for example, the right ventricle failure, whenever the right ventricle is not able to pump the blood, as a result, whatever the thing we'll see, the blood that will be not ejected by the coronary artery to the lungs, that means the blood that will not come within the lungs. Now, whenever the blood that will be not reached within the lungs, as a result, we'll see there will be the accumulations of the blood wire within the right ventricle. Now, see whatever the thing we'll see after that, we'll see the blood amount that will be less within the lungs because the right ventricle is not able to pump the blood properly. Okay. Now see, as a result, we'll see what the accumulations of the blood within the right ventricle over here. So accumulation of blood within a right ventricle. Then if the blood is accumulated over here, then it will, whenever we will see that over accumulations, as a result we will see the blood is also starting accumulating where? The blood will start accumulating within the right atrium as well. So after that we will see the blood accumulation within the right atrium. Now see, when as a result we will see ultimately the blood that will come over here within the superior vena cava, inferior vena cava. In terms of the superior vena cava, we want to say that the blood that will get accumulated within the jugular vein regions. So as whenever the blood that will get accumulated within the jugular vein, as a result we will see the pressure within the jugular vein that will get increased. So you can say the pressure within the jugular vein that will get increased. So jugular venous pressure that will get increased. So ultimately we will see over here the jugular venous pressure that will be increased. The next thing, whatever the problem we will see, if we just talk in terms of the inferior vena cava, then the inferior vena cava that takes blood from the different important organs from the lower aspect. For example, I'm just considering here, it drains the blood from the liver. It drains the blood from the liver. Now, whenever the inferior vena cava is able to drain the blood from the liver, as a result, we will see the blood that will get accumulated within the liver. As a result, we will see the chances for having the hepatomegaly. The size of the liver that will get increased. The size of the liver that will get increased. Okay. So we'll get over here another thing. What? Hepatomegaly. This is another thing we're getting over here. Now, if we talk about in terms of the, for example, from the aspect of the left ventricle, that means the left heart. For example, I'm just considering it over here. Now see, okay, for any reason if we see that the left ventricle is not able to pump the blood, that means if you see the failure within the left ventricle, so whenever the left ventricle that will be failed to pump the blood, so the blood that will be not able to go within the aorta, that means within the aorta to squeeze the blood, to contract the blood, to send the blood to the different in the systemic circulations, that will be less. So whenever we see the left ventricular failure, as a result we will see the aorta, in this cases the amount of the blood that will be less. So whenever within the aorta the blood will be less, so it is not able to pump the blood. As a result we will see the accumulations of the blood where within the left ventricle first. So within the left ventricle we'll see the accumulation of the blood that will get increased, and followed by what? Left atrium. So in the left atrium, then we'll see the what? Whenever the blood will be accumulated over here. So whenever we see too much accumulations of the blood, then the blood that will get accumulated within the left atrium. Okay, so within the left atrium we'll see the what? Accumulation of blood. Now from where this thing takes the blood? From the lungs we know. Okay, so from the venous route. See. Now there is a chances for the accumulations of the blood within the what? Lungs. Okay. Accumulation of blood just like this. So whenever the blood that will get accumulated within the lungs or the fluid over here, that will cause the pulmonary edema. So that will cause pulmonary edema. And whatever thing we'll see over here, we'll get the cough, production of the cough, we'll get the dyspnea, that means shortness of breath. With this type of the manifestations, we'll get over here. Okay, now why we are saying this, the congestive means accumulation of the fluid. Now see, in the different organ levels, if we just compare, we are seeing that the accumulations of the fluid over here, we are getting the accumulations of the fluid in the different chambers. Okay, so as a result, we can consider that disease or the conditions as what? The congestive heart failure. Now we'll talk about what type of the drugs we can use. Now see, now just to treat this thing, we can remove the fluid from the different regions. Now if we can remove the fluid, or if you can reduce the volume of the fluid from the different regions where it is getting accumulated, then we can treat. Another thing we can increase the contractility power of the heart. The heart is not able to pump. If we can increase the contractility power of the heart, then you can treat the disease. That means we can treat the situation by the two conditions. One, we can remove the fluid. The next thing, we can just increase the contractility of the heart. So for that thing, let me write it over here. The first drug we can use over here in terms of the diuretics. Diuretics means that will decrease the volume, that will remove the accumulated fluid from the body. And the second thing, the drugs that we can use in terms of that will increase the contractility of the heart, that is known as inotropic drugs. So inotropics. Okay. Now at first we'll talk about the diuretics. So let me tell you guys about diuretics. I am having a separate video where you will come to know in details about the diuretics. Here I'll say the brief descriptions about the diuretics. Okay. So if I say over here diuretics, basically you can get the diuretics in the two types. Okay. One is known as loop diuretics. Another is known as thiazide. Now see, the loop diuretics, they are short acting and fast acting. That means, okay, let me write it over here. They are short acting and they can remove a large amount of water molecules from the body within short time. Okay, so you can say what is strong. Okay. What about the thiazide? They are weak. And they are what? Slow acting but long acting. That means they will act gradually. Okay. See, in these cases they will act very fast. So that's why they are short and fast acting. Okay. Short and fast acting. But whatever the thiazide they are weak. That means they will just act gradually. Okay. But the acting of the drugs, that will be what? The longer durations. Now in these cases we are supposed to prefer which type of the diuretics. In these cases, as we want the fluid to go gradually over here, so we are supposed to prefer the thiazides. It's a preferable. Okay. Now there are some common side effects in between the loop diuretics and the thiazides. So let me write it over here. The common side effects. They will decrease the various types of electrolytes. They will decrease the amount of the various types of the electrolytes. Let me show over here. Okay. So sodium, then the potassium, then magnesium, and then they can also decrease the proton. Okay, whenever the amount of the proton that will get decreased, that will cause what? Metabolic alkalosis. Metabolic alkalosis. What about the calcium? Now there is some differentiation in the calcium. See, the loop diuretics. The loop diuretics that will lose the calcium. That means that is responsible for having the hypocalcemia. What about thyroid? That will increase the level of calcium. That means that is that is responsible for causing hypercalcemia. Okay, and these are the common side effects. And some side effects, for example, they will increase the blood sugar level. So blood sugar level they will increase. That means they can cause the hyperglycemia. The next thing, they can increase the lipid. Okay, they can increase the uric acid as well. So these are the common side effects. Okay, in between the loop diuretics and thyroids. And only for the calcium, in terms of the calcium loop diuretics, that will what loses the calcium. That means that is responsible for causing the hypocalcemia. Whether the thyroid, that is responsible for causing hypercalcemia. Okay. Now we'll talk about inotropic drugs. Okay. Okay, now before starting the inotropic drugs, let me say you guys that we all know that within the heart there is presence of what? Beta 1 adrenergic receptors, right? Beta 1 adrenergic receptors. Now, for examples, I am taking a hypothetical cells within the heart over here. Okay, now see, we know there is the presence of beta 1 adrenergic receptors over here. Okay. Now, if you can stimulate the beta 1 receptors, we know that whenever the beta 1 adrenergic receptor that will get stimulated, that will cause the contractility of the heart. Okay, that is responsible for contractions of the heart. So we can give in terms of the inotropic some beta 1 agonist. Some beta 1. Let me write it over here. Beta 1 agonist. Now, whatever the drugs we can use over here. First, we can use the dopamine. We can use dobutamine. We can use isoprenaline. And we can use some noradrenaline. Okay. Now see, the dopamine that acts where? In terms of the alpha 1 receptors. Okay. That acts also the D1 and beta 1. So, or these are things what the beta 1 is acting on the beta 1 because we need to over the beta 1 agonist. Whatever dobutamine, it acts only on beta 1. Whatever isoprenaline, it acts where? In terms of beta 1 and beta 2. And what about noradrenaline? It acts on alpha 1, alpha 2 and beta 1. Now see, everywhere beta 1 is present, so we can use these drugs. But see, whenever we give the drugs, they will, for example, if we use the dopamine, whenever they are activating the beta 1, along with the beta 1, they will also activate the alpha 1, they will activate what? The D1. For these things, we will see the various types of the side effects. But as we know that the dobutamine only they will stimulate the beta 1, so it's the preferable one. Okay. So it's the preferred drugs over here. Okay. Now we'll know how the drug is acting over here. Okay, a little bit of the mechanisms over here. Now see, whenever the drugs, which drugs, beta 1 agonist will come over here, they will stimulate the beta 1 adrenergic receptors, and we know that beta 1 adrenergic receptor, that is what? G protein coupled receptors. So that means there will be presence of G protein. There will be presence of G protein coupled receptors. And we know they can activate what? Here we will get the two types of the products after activations. One is the inactive product, and another will get what? Active product. And whenever we are just talking in terms of the active products, we know there is a presence of one type of the enzyme over here. It is known as adenylyl cyclase. Now, this enzyme will convert the ATP in terms of the active product into cyclic AMP. Now, this cyclic AMP is responsible for causing the contractility of the heart. So that will lead to the contraction of heart. contraction of heart. Okay. Now this is the thing. Now we can use some drugs. There is an enzyme within these things that is known as, for example, phosphodiesterase inhibitor. Phosphodiesterase. Okay, let me write it over here. Phosphodiesterase. Okay. Now this enzyme, they can what? Break down the cyclic AMP. Now whenever the cyclic AMP will get breakdown over here, so there will be no activations of the cyclic AMP. As a result, contraction that will get decreased. Now if you want the heart to contract continuously over here in these cases of the congestive heart failure, then you can use some alternative drugs that will block the phosphodiesterase, that will block the what? Phosphodiesterase enzyme. So whenever we can use the phosphodiesterase inhibitor over here, as a result we will see that will not let the phosphodiesterase to break down the cyclic AMP. So as a result, what the concentration of the cyclic AMP that will be more. So for the acting duration that will get also increased over here. So the next group of the drugs after the beta agonist, we can use over here what? The phosphodiesterase inhibitor. And in this group we'll get some drug that is known as amrinone, and you can get also the milrinone. Amrinone and okay, and then the phenolinone, new drugs. Okay. Now see, amrinone and milrinone, this type of the drugs, they will what? They will inhibit the phosphodiesterase enzyme. As a result, they will increase the concentrations of the cyclic AMP. As a result, we will get the contractions or the contractility power of the heart that will get increased over here. Okay. Now we have to know over here that when you are working in terms of the amrinone and milrinone over here, okay, they inhibit the phosphodiesterase enzyme. Okay, it's good. But this phosphodiesterase enzyme is not present only within the heart. This phosphodiesterase enzyme that is also present within the blood vessels, for example. Okay, so whenever the phosphodiesterase enzyme that is present within the blood vessels, whenever you are using the drugs, amrinone, milrinone, they will not only inhibit the phosphodiesterase enzyme within the heart, they will also inhibit the enzyme within the blood vessels. So whenever we will see this enzyme will be inhibited within the blood vessels, they will cause the vasodilation. Vasodilation. So whenever they are causing the vasodilations over here, okay, and they are also using as what? The inotropic drugs. As a result, we can see over here that the phosphodiesterase inhibitors, they are what? They are doing as inotropic drugs. So inotropic plus vasodilator. So in a nutshell, we can say, we can call them as inodilator. They are the preferred drugs in terms of, we see that in terms of the right heart failure, they are more beneficial. Okay, they are more important in terms of the right heart failure. Now we'll talk about, for example, any individual who is having what? For example, acute, congestive heart failure. Acute congestive heart failure. Okay, we'll talk about the circumstances. So let's talk about over here. Any individual who is having the acute CHF, acute chronic, the congestive heart failure. In these cases, we will see whenever the congestive heart failure will be over here, definitely we know whatever the thing we will see. The main thing is over here, the cardiac output that will be decreased. So whenever the cardiac output that will be decreased over here, okay. So we know that in our body there are certain types of the protective mechanisms that will not let the cardiac output to go down, and as a result we will see the activation of sympathetic outflow. Now the sympathetic activations we will see over here, activations, and whenever the sympathetic activations will be activated over here, we will see they will stimulate the beta 1 adrenergic receptors, and whenever the beta 1 adrenergic receptor will be activated over here, they will maintain the cardiac output. So cardiac output that will be maintained. But the problem is over here, whenever the sympathetic activations will be seen over here, they will not only activate the beta 1 adrenergic receptors, they will also different types of the receptors as well. Now see over here, whenever it will be activated, it will also activate the alpha 1 receptors. It will also activate the alpha 1 receptors. And whenever the alpha 1 receptors it will be activated, it will cause the vasoconstrictions. And whenever the vasoconstrictions we are getting, in the two ways we will get. Okay. For example, we can say venous constriction. We can say in terms of what? Arterial contraction. Arterial constriction. Now try to understand from here. Whenever the artery is getting contracted, okay, let me show over here with the example, then it will be easier for you guys to understand. See from here. See, whenever for example, the aorta is getting contracted, now, whatever the problem we will see, the left ventricle needs to work more to push this amount of the blood. Now see, whenever the aorta it is contracting, as a result, whenever it is contracting just like this, then the left ventricle needs to pump more to squeeze the blood from the left ventricle to the aorta. As a result, we will see in these cases what will increase, that afterload that will get increased. Afterload that will get increased. Okay, this is the problem. And what about the preload? Preload means before contractions. Let me show over here. If you see the venous constrictions, if we see, for example, if we see over here the venous constriction in these regions, if you see the venous constriction, then whatever the thing we'll see, if the venous constriction is seen over here, then the more amount of the blood that will come over here within the ventricles. As a result, the ventricle needs to work more to push this blood from the right ventricles to the lungs. So as a result, we will see the preload that will get increased in terms of the venous constriction, and the afterload that will get increased in terms of the arterial contraction, in terms of the aortic constrictions over here. And whenever the aorta that will go under relaxation, at the time the left ventricle needs to work less. So as a result, we see the afterload that will get decreased. And whenever we see also the venodilations over here, whenever we see the dilations within the vein, as a result, we see the less amount of the blood that will be reached where within the right ventricle. As a result, the right ventricle needs to work less to push the blood from the right ventricles to the lungs. Okay, so the preload that will also get decreased over here. But the problem is over whenever the sympathetic activity that will get that will get increased over here, they will maintain the cardiac output. It's good, but the problem is over here, they will cause the what? They will increase the preload. They will also increase the afterload. This is the main problem. Now, what are the next problem we'll see over here? See, okay, let me show over here. That we know that the beta 1 that is also present where? The beta 1 that is also present in the juxtaglomerular cells. Okay. Now, whenever the sympathetic activations, we will see that whenever there will be sympathetic activations, these juxtaglomerular cells, they will start releasing renin, and whenever the renin that will be secreted, that will convert the angiotensin. For example, this is the angiotensin from the liver. This protein will be secreted. The renin will convert the angiotensin to what? Angiotensin 1. And whenever we are getting the angiotensin 1, whenever it will go to the lungs, we know that within the lungs there is a presence of angiotensin converting enzyme that will convert the what? Angiotensin 1 to angiotensin 2. Now it can activate on top of the receptor that is known as AT1R, angiotensin 1 receptors. Okay, on. Now whenever it will be activated, it can do the several functions. Another function, it will just do the what? Constrictions. Because the constrictions, okay. So vessels constrictions we'll see over here. The next things over here, okay, we'll see in these cases they can also activate the adrenal medulla. So whenever the adrenal medulla that will be activated, they will release more amount of the adrenaline, noradrenaline. So adrenaline, noradrenaline. Okay, and whatever the last thing, they can also activate the aldosterone. The main problem we'll see over here. Aldosterone. Now see, whenever the aldosterone will be activated, we know they will what? They will just do the retentions of the sodium and water molecule. As a result, we will see the what? Blood pressure that will get increased. Okay, and blood volume that will also get increased. The next things about them, they will just loss of the what? Protein and potassium. They will cause the loss of protein and potassium over here. Now, if we see normally, what do you know? Whenever the aldosterone will come, it will work for a short duration. After that, its function will be lost. Okay, but for any reason, if we see the aldosterone is acting for longer duration, if we see for longer duration, then whatever the problem we see here, see, we'll see there will be that will lead to the formation of left ventricular hypertrophy. Left ventricular hypertrophy. That will lead to cardiac remodeling. So from here, we'll get the cardiac remodeling. So cardiac remodeling, and most of the cases we also see, ultimately we'll see the death of the patient. So this type of the thing we'll see in these conditions. Okay. Now whatever the things we are getting in terms of the acute chronic, acute congestive heart failure, whatever the things we are getting ultimately over here, that what the left ventricular hypertrophy, we are getting the main point over here. Then we are getting the afterload that is also increasing, the preload that is also increasing. So this type of the thing we are getting what increased. So as a result, we know that I have already said you guys over here that whenever the sympathetic activations is over here, they are just maintaining the cardiac output. It's good, but along with that maintaining the cardiac output, they are just doing this sort of the thing. As a result, we will see the more and more pressure and the force that will come under the heart. As a result, we will see this type of the problem. Now, whenever all these types of the things we are getting over here, that will lead to the formation of what? Chronic congestive heart failure. Okay. So in the next part of the video, we'll talk about what type of the drugs and the management you can do in terms of the chronic congestive heart failure. Okay. So thanks for watching. See you guys in the next video.